who is the Director of Finance, as well as Mr. John Hudson, who is the Chief of Administration. Sheriff Hall, you have the floor.
Thank you, Madam Chair, and thank everybody for having us here. I know it's getting late, so we'll talk fast for as long as you need us here. I'd like to introduce the three people who run the Sheriff's Office in the back of the room. They all have the title of a chief, but we have our Chief of Staff, Carla West, our Chief Deputy is John Ford, and our Chief of Corrections is Mr. Tony Wilkes. Just appreciate them being here and really for what they do every day running a very complex organization. You know, I've been here 20 years at this process, and I've been in the Sheriff's Office for 30 years, and I'm qualified to tell you this is the most complex year we've ever experienced, and we don't have to ever mention COVID. What we've been through in that organization, taking COVID off the table, and I wanted to just run through a list of these things that may or may not have been known to people in our community just because of all of our disruptions, I guess. But in January 2020, actually on New Year's Eve or New Year's Day morning, I guess, I was informed of an individual who had infiltrated a construction site across the street, a nearly $200 million complex. That situation is in the courts, but just to summarize it, this individual planted loaded guns inside the concrete inside of a secure facility in which you do not carry weapons. And so he did this over a period of time, was a known advocate for safe jails and prisons in this country, and I know him as a person. It's extremely complex. I will promise you this will be a movie, and I'm not proud of that because the movie, unfortunately, ends better than it was supposed to. This was a tremendous loss of life. And I could go on and on. I could spend the rest of my time just talking about that one event. That's in January. It delayed the opening of this complex that we've been working on for 6 years. For several months, we had in this country the top inspectors of places like concrete and walls and steel, from the Border Patrol to the FBI to actually overseas, were sent here to help us search this facility because I wasn't moving people into it until we knew it was safe and secure. And so that took us a while. But that's in January in a year in which we didn't know what was coming. But that was a big event, and in my 20 years, the most significant thing I have experienced as it relates to what all went on with that. So that's in January, and we all lived through other things, but come around in March, we experienced a thing called the tornado in the city, but the Sheriff's Office, at least where I lived for the last 20 years, my office and the administrative building and the jail right down the street took a direct hit in the tornado. That's not significant, except we had to pack up within 72 hours. The next thing I know, we were in a vacant hospital up at North at Memorial Hospital. We've lived up there for the last year, packed our boxes and reorganized in the early stages of March. Because I wasn't going to bring up COVID, just know that started about the same time. We were all trying to learn what was going on. I sent all of our non-essential personnel home, and that began what this experience called COVID was. So that's in March. In the month of April, because of a thing called COVID, we had to open this new complex. Now that it was clear and clean and safe and secure, we opened it as a COVID hospital for inmates. We had a significant number of people who were testing positive, and it was new to all of us, and we were moving people in that building, not for its primary purpose. It was designed to be a booking room and a housing of all arrestees. Instead, it was now serving as a hospital, and that happened actually in April. On Mother's Day in May of that year, we opened the facility in a fully functioning detention center where all arrestees were booked and housed, and it became what it was designed to do. And any other year coming up here, that's what I would tell you was the most significant thing we did this year. It was not. That was getting us through the early stages of May. We get to July, and Councilmember Benedict and others may remember, as I've said many times, COVID wasn't on our list because now we're being asked to take on the whole private prison or private operation of a facility in the middle of all this stuff that was going on. The debate about that, I think, ended in July with the end of the contract set because of the Core Civic pulling out of the arrangement. Put us on notice in our city that we were going to have to take over the facility in October of that year, which again, if I had nothing else on my list, that would have been the biggest thing we did this year. Very complex thing to do, very complicated to do that. Anyone in my line of work would tell you it's 18 months to 2 years to do it, and we're now at 3 months in the middle of everything else that I was telling you. We get through August, must have been boring. I don't have anything on my list. We get to September of that year, we open the BCC. My passion has been to decriminalize mental illness. Been working on this for a long time. In any other year, it's all I would have talked about. This has been the coolest thing to talk about. The city is way ahead of most jurisdictions. The ideas, the opportunities that we have are tremendous. Unfortunately, we had to open it in a quiet way with masks and social distancing and other things that wouldn't allow the public and even the providers to really understand what was going on. But that was an exciting thing for us, at least in the middle of September. As I mentioned earlier, the conversation ended in July, but the work took over October the 1st. We took over a 1,200-bed prison that had been operated for 30 years by a private provider. The inmate numbers were about 550. The facility was 1,200 beds. It was taken what we call in our line of work convicted felons because they were serving prison sentences. Sheriffs typically run the jail side, and Department of Corrections typically run the prisons. So we were taking that over in the middle of October at 6 o'clock in the morning, and now we're transitioning their employees into our payroll because they're very hard to find people to do this line of work. We were trying to find anyone and everyone that was qualified, and why not start there? We did that in October. We then assumed responsibility for that facility, and 30 days later, it was determined by the state of Tennessee and Metro and others that the facility was not able to be housing inmates any longer. Has a significant piece of infrastructure that needs to be dealt with. It wasn't a crisis in the sense of, oh my God, today something's going to happen, but we were facing the winter with very poor heating, hot water, and so forth, and so it wasn't like an overnight problem, but we didn't see it being a safe way to house inmates throughout the winter. So in December of this past year, we moved all of those inmates out of the MDF facility that had been managed by the private contractor into one of our vacant facilities and made a lot of arrangements and changes to do that. They then moved over, like I said, in early December. Thank goodness, that's the end of our year. That was a lot of work, and every one of those things in any other year I've been up here would be what I would talk about. The thing that gets lost, and because we're here to talk about budgets, I want to emphasize this. You know, for years I've come up here and said we believe in programming and reform, and let's do some things. We've done a lot of things. I could spend the rest of the night talking about it. We're still doing it. One of these days that was going to pay off, and we're going to get to sit here and talk about the reduction in our budgets and reduction in cost, because that is important. This year we're significantly under budget. That'll be known as we get closer to the end of the year. Several $100,000 easily in a year in which we're all transitioning people all over this town. So we're very proud of that, but unfortunately, that's probably the beginning, and I can't give you, I guess, the best news. The better news is, in this coming year, in working with the mayor's office, and by the way, they've been fantastic. I'm qualified to tell you, I think this is feels like my 17,000th mayor in the last few years, but we've had a bunch of mayors in my time. I'm qualified to say they have cooperated and worked with me. I don't come up here and do that. I'm not asked to do that. When I say work with me, this organization is complicated. It's complex. I needed someone to at least listen and understand what we needed. They reached out to me earlier in the year and said, look, how are you budget-wise? I said, I'm in great position. I want to give money back. I will tell you what the number is going to be. We discussed that. There's $1 million cut out of our budget moving forward for next year. That's just the beginning. Our buildings are more efficient. That's what we said we could do. We also believe in changing people's lives. I mean, I don't want to be housing people for the rest of my life. My goal is to try to give people an opportunity to change their future, and we believe we do that. Unfortunately, that's lost in all the stuff I just told you because we've worked extremely hard on the very boring things such as managing our money. In the end, today, if the last 12 months have been boring to you, today we moved out of the Memorial Hospital into what is our future home over on South 5th Street in East Nashville. It was a workhouse for over 100 years. We've had that property, the sheriff's office has. And about 4 mayors ago, I think we started the idea of consolidating our operations, not housing inmates, but consolidating the rest of our operation. And it's not official, but I took my boxes, by God, and I moved in this morning. It's fantastic. And so 12, 13, 14 months, I'm qualified to tell you that's a lot of work. And the people who are sitting in here and across the street have earned their money, and they deserve our respect. So with that, Madam Chair, I'll answer any questions.
Councilwoman Benedict.
Thank you so much, Sheriff Hall. Couldn't have a better sheriff, in my opinion, in the country. You did a superb job last year.
Oh, thank
and
you.
we talked about that at the time, and you were put in a very difficult situation as a result of some legislation that I had been working on. And your team did a phenomenal job and did something that I was not intending to ask them to do, and I didn't ask them to do that. Regardless, I couldn't be more pleased with the result. I can't believe you're saving more money, and you're doing a great job. I'm going to have to leave right now. I have a work appointment down the street. I just wanted to stand up and thank you for that work and for all of your employees to know that it's appreciated. Thank you, Sheriff.
Thank you very much.
Councilman Bradford.
Thank you, Chair. Before I get to my question, I'm just going to kind of follow up on Councilmember Benedict. I mean, she touched it all. You were dealt a hand this year, and you came out splendidly. And I don't know any other sheriffs in this country that could have taken, everything going behind the scenes, the pandemic, the emergencies, and then having to completely deal with this transfer from Core Civic to your department in less time than most people are allowed. So big props for that. And also state that it's kind of a sad feeling knowing that there's one chief that is not in the gallery watching us today, and that is Chief John Taylor Jr., who is retiring. So wish him well in his retirement. I know he's been a big part of both Metro politics and this council and the sheriff's office. And also commending that with everything going on, you've been able to save money and that's going to be a benefit for the taxpayers. Going to my questions about your mental health facility. In previous conversations, I've asked this. I'm just going to ask this for the benefit of those watching. This facility opened at a time when probably the numbers that it was based off of was low because there wasn't that many instances going on with people staying at home and not being on the streets. Knowing what we are seeing with post-pandemic with those who may have contracted COVID, and that there is concerns that could cause further mental health issues. The facility that we already have, is there room in the current building, if need be, that could be expanded to handle any potential increase in calls of service for mental health?
Yeah, great. Can I go back because you triggered something? Just want to mention this. Councilman Bradford mentioned John Taylor. John Taylor and I and Chief Wilkes and Miss West and Chief Ford grew up in the sheriff's office, and he and I are the same age. We went to work there at the same time. He texted me just a few minutes ago as we were coming up here. He's having some significant health challenges, and gosh, 34 years, 35 years. I really appreciate you guys at your leadership recognizing him last night. We're going to have an event here in a month or so, and he's done a tremendous amount of work in Donaldson. He's done a tremendous amount of work for me personally, and I say that. Good guy. And wow. I've never been here. He wasn't back there, so I just that's your fault. Why did you get me off on that? So mental health. Speaking of crisis, yeah, it's a passion of mine, and when we built this facility, it came after a tremendous amount of work on data and deep diving into what's going on. Most systems in this country do not understand who's going to jail. It's just the truth. Most people, I'm not saying anybody's at fault, but the arrest is part of the story. I tell people all the time, the most important thing in law enforcement is there's two things that you're trying to arrest, the person and the problem. Most people focus on the person. That's okay, right? I think my job is to focus on the problem. The problem is when a person arrives, we need to understand what brought them here. The reality of that is most of the time in addictions and mental health, you've covered the bases. There are other exceptions, very rare. And so if we're going to keep building our way into this crisis of housing people in courts and criminal justice, then I think you're going to get what you've always asked for, which is continuation of that problem. Done a lot of research in the 60s and 70s. We said we're going to deinstitutionalize the hospitals. No, we didn't. We just reinstitutionalized them in corrections. It's a direct correlation. I can show you the numbers. The math is easy. It's not the police fault. It's not that simple. It's not the sheriff's office fault. society, really, think it's hidden because it goes behind the wall. And it's my fault for continuing to enable that if I don't bring you a solution or at least an improvement. And so one of the things that happened, as Councilmember Bradford said, is we built a building for a purpose. The purpose was that people who are arrested are brought to us. We then take the custody and the responsibility for that individual. We know the individual far better than anyone else. We live with them. And so after the police drive away and before the courts ever even see them, we live there 24 hours a day. And when you live there realizing and seeing and witnessing people deteriorating, then you can either accept that and move on, or you can try to accept the fact we're going to do something different. And so many years ago, I came in here and said, I want to study the fact that we're going to need a new detention center and new operation. And so when we started that, which was Mayor Dean, the idea was we don't just need a jail, because I knew the population inside that jail was not going to be cared for, it's the right word, if all you do is build a detention center. That's what we all do. And so we did a deep dive, and basically 30% of the arrest population are diagnosed mentally ill. That's done by a diagnosis of a mental health professional upon arrival to a jail in this country. It's a real easy number. Women are higher ranked than men in that. I can do a lot of math for you. We did the math of the people coming to jail who have other related matters that are diagnosed mentally ill. When you do the math of how long they should stay, which we believe mental health would tell you is not long term. You don't want them long term in a setting like this. We want to transition that individual into the community. So 30 days is the goal of the person, the max of the person. And you do the math, and we needed 30 beds for males and 30 for females. Councilman Bradford's point is well taken, that if your arrest population ever start to trend up, you need to address additional beds in mental health. Remember that. Don't let just the arrests go up. I've been here 20 years. The arrest population has dropped. The housing in my jails have dropped in half in 10 years, and they're continuing to go down every year. It's not COVID driven. So if you'll focus and keep doing that, in 10 more years, you don't need this job. But if you don't do something about the people who are coming who also have an illness or an addiction, then you're just going to rearrest that person over and over. And our job is to try to reduce that. I love your question, and I hope to God we don't ever need it, because I hope we can change the likelihood of that arrest person being involved with the criminal justice system. So ultimately, the answer is yes, but please don't build it so they will come. Let's try to make sure people are getting care and don't come in contact with criminal justice. That's a long answer. Your fault.
Well, I'll take that, and I appreciate your answer to that. And I definitely don't want us to be in the process of building something and hoping that it gets filled up. I just don't want us to be in a situation where we've spent all this time, millions of dollars to build 60 beds, only to find out, okay, we cannot expand this, so we're going to have to spend another $100, $200, $300 million to build extra space. So I just want to make sure that in other things in the city, we've not been very forward-thinking. We've always been very reactionary. Yeah. And so I wanted to make sure that the taxpayer dollars that we have invested in the mental health facility, that there's room, there's a buffer built in so that we don't have to build a brand new building somewhere else in town, that we can just expand a wall or add into another room if needed.
And maybe I wasn't fair to Councilman Bradford. Here's the thing I would ask you guys to do. The only way I can ever deal with the individual is if they have a criminal charge. My goal in the future is build a building that I built in another part of this community where the police aren't involved. Right? I mean, you want that too. I hear it earlier tonight. You don't want the arrest to happen. The reason we did it is the number one reason a mentally ill person comes to jail in this town right now is not a new arrest. It is an old charge they didn't fulfill because they're off their medication, because they're not responsible at that time in their life. So the reason I did it was, if you bring me a person who has a warrant and must be arrested and the police have no discretion in that situation, I want to be diverting that person without going to criminal justice. I think your point's well taken, but build that facility in a place where criminal justice isn't involved, so you won't collateral damage this person for long-term criminal histories and charges and fines. And so you're right. You're exactly right. But I hope the next investment is to build it where the police and myself and the courts are not involved at all.
I appreciate your time and your service, Sheriff Hall, and I say this not to be mean, but I hope in 10 years that we do put you out of a job, because you've earned a very, very good retirement with all the work you've done.
Don't let them take that away. I think that referendum's going to take our money. I need a health care or something. I don't know. One day. Thank you, though.
Sheriff Hall, in your questionnaire, you mentioned 112 unfilled FTE positions. What are those positions, and is your goal to fill those positions or not? Because I know you talked about efficiencies, and I don't know how that 112 plays into that.
Yeah, that's one of my favorite things when you look at our numbers and budget and everything else. And I've been here a long time, but here's the thing I never thought I would say. Budgets aren't the problem in what I do. Budgets aren't the problem what the police do. Chief Drake's a friend of mine, but the truth is finding people who you can hire to do it in those positions you're talking about is far more of a challenge. I love Chief Swan. He's a great friend of mine too, but it's a lot easier to hire in the fire department than police and sheriffs, always. So they don't have the same challenge we do. We have challenge of finding qualified people who will do this job. And so those 112, we don't need every one of those FTEs. We don't. I mean, that's where some of that savings will be realized. But what we're struggling with, our community like Nashville's got all sorts of opportunity. It's a tough job, and finding people who are qualified to do it allows us, hopefully, to fill the ones that we need. Our population is going down. We should see more savings in that. One of the things I know the mayor's office is working on is reducing the fines and taking fines away. The money saved from the sheriff's office, my understanding is, maybe used to do a lot of that. And so the future is, my fear is, I can't give you the 112 positions. I can sure give you most of that money as we go forward, because if it ticks tomorrow, I've got to be able to hire people. A lot of our positions are correctional officer positions in that 112. What I've done over the years is move a correctional officer to titles like Steer and Clear. That's a program we have in the courthouse that restores driver's license. And so we're moving people out of what you would call officers when we can into positions that are diversionary. And, ultimately, I really do worry. I worry about the ability to fill essential positions. We had, I believe we had the largest percentage of all the government staff who were positive COVID because of the line of work we're in. First responders are important. That person does an incredible job at 2 in the morning in the middle of the streets. That's dangerous. But when you have an airborne disease, I'd rather be in a fire apparatus or a police car as I had living inside a jail where airborne diseases are everywhere. And so we were trying not only to make sure our staff were safe and our inmates were safe, but keeping people healthy enough to come to work is a very big challenge. And so that is some of the realized savings, but it's a challenge finding people. And the police and myself, departments I know are challenged by that.
So of that 112 positions, how many of that would you consider to be essential positions?
The title, the positions that they're holding, I would say is 95% of those are essential. And what I mean by that, those are officers that are either retiring or leaving or coming. I'll tell you something that's about 10 years ago. I had a student at Trevecca, and I asked him to come to the sheriff's office and help us do some research. I'm kind of nerdy when it comes to this kind of thing. I said, I'd like to study why people don't retire. We work hard. We all talk about it. And we have employees. I have people working at the sheriff's office. I've been there 55 years. And so I wanted to know why. We studied it for over a year, and this is a master's level person in research. And the reason someone doesn't retire after working extremely hard in this line of work is they lose their identity, and they can't afford 40% of their income. And that sounds obvious. I don't know that I knew that, but I wanted to know that. So what I did was I spent the next year, we had a lot of staff, and we worked really hard and developed a program. It's called STEP. We started over 10 years ago. By the way, that term is used all over Nashville. It was us that did that. It stands for Starting to Enjoy Your Pension. So what happens is if John Hudson works for the sheriff's office today and he is pension eligible after 10 years, 15, whatever he wants to do, if he wants to come back to the sheriff's office, I will hire him part-time at the hourly rate he left me at. Here's why. I need his institutional knowledge. I need his ability. We trained him. We paid him a lot of money to get him here. Most people in his job, if he were to take the retirement, it's cutting most of his salary, and he has no identity. So now he's at Home Depot. It's not a bad place. He doesn't have the identity. He also doesn't have the income that he used to have. So what I do is I say, take your pension, start to enjoy that, come back here 19 hours a week, and I'll pay you the 19 hours. That's a great win-win. He's happy. But you know what happens? I move the operating budget dollars to the pension fund. Very solvent, by the way. Pension's not going to go broke anytime soon. So the truth is, he deserves it, the money's in there. So 2/3 of the cost of him moved to the pension fund. Comes off of my operating budget. Saves me millions and millions of dollars every year. We have nearly 100 people in my organization that are on STEP. And the reason I bring that up is, unfortunately, there's an accounting trick or tool, whatever it is, that that part-time person counts as a full-time equivalent in the system. And so one of the things that makes me nervous is when we give back positions sometimes, it may hamper my ability to continue to put people on a STEP program. Madam Chair, I didn't mean to divert, but I was trying to explain our numbers are, a lot of those are part-time employees over the years. Saves money.
Okay. And with the taking over the Core Civic contract, do you know yet if the state is going to reimburse at 100% of costs?
Well, I thought that'd be the first question. No, I had emails today with the state. Here's a process just to kind of, at the end of our fiscal year, Pete Lutz right here and my finance staff will compile all the supporting documentation, and there's a formula we have to submit back to the state and says, here's our reasonable allowable cost to house your inmate. The program acts as if though it'll pay you your money. We believe they should. I've told the people who asked when you guys were thinking about doing that, I don't believe we should do it at the expense of the local taxpayer. If we, that's an opinion. So we have notified the state on what our costs look like, and those are just numbers. There's ranges of it, and we've informed them of where we are in the process. My understanding is we submit that sometime in July. There's some banter back and forth inside the metro government, and sometime in September, October, we will get a full agreement, understood cost. And then I think this government has to decide, do you want to keep doing that or not? That's just my opinion. Meaning, do you want to kick it back to the state? Do you want to stay in some cooperative arrangement? But the answer is, I wouldn't know in my office until probably October what they're going to pay us back. I can tell you in about 6 weeks what it's costing us.
Councilwoman Gamble.
Thank you, Chair, and thank you, Sheriff Hall, and all of your staff for the yeoman's job you did in taking over the county jail with such a short time frame. I noticed in the proposed budget there's maybe an increase of about 50 positions that will be funded. Is that correct? Okay. No, there are no new positions.
No,
okay.
no, ma'am.
Well, that answers my question. Can you tell us how the transition has been with the new jail and taking it over this time and getting over the COVID, to just give us an idea of what's going on?
Yeah, and I apologize. I forgot you was in the corner over there. I'm all hyped up in the front. That's my fault. So, yeah, it is a very complicated thing to do. And I say that because these were private employees. And I hate to say this, if you wanted to go get on civil service employment in the government, it is complicated, time-consuming, difficult. It is. It's just a tricky thing to do. So if you just take, their titles were different. Their training was different. Their pay structure. I mean, I put them on our payroll a month before we took them over, just so we could train them, because the liability was, so it was so complicated. And we're having to take them after they worked a 12-hour shift in the facility, send them to 8 hours of training. It was very, very complex. And so you do all that, and there's little things that we didn't think about early on. You're having to take over contracts that they have with the cleaning service or contracts with the vending service. I mean, so many things in a crisis management way. My staff deserves, gosh, I mean, it's not fair that that's not talked about. It's not. It is, they work their tail off. And I mean, it's, the good news is this. The employees that came over love it. Okay? That's not because, I'm not here to beat up on the private situation. I think that's way overplayed, personally. My opinion is they loved it because we needed them. And we told them that, and we needed them to stay. And I think we're treating them right. We've promoted a bunch of them. I saw a young man the other day. He's been promoted twice, and he's just tickled to death. So I'm happy for them. They didn't deserve this either. They're employees who were kind of in limbo, and we were like, please stay on. And so, just to give you some numbers, we took over 181 of their positions. We have 97 now doing that work, meaning so that we didn't need as many as were out there, and we've been able to save and some efficiencies there. But it's, if it was our only thing, I would be really proud. It was just stuck between so many other obstacles and the people that are working, tonight that did all that. I appreciate you asking. I appreciate your awareness of, what it really is. That is a tricky thing to do. And again, the inmates' families, communication tools. You shut all that down to start a new system, and it was not easy. And by the way, there's a thing called COVID. People on quarantine, medical services are changing hands. I mean, it was and kudos to everyone of those people who work for you. They did a great job.
Councilman Bradford?
Thank you, Chair. So Councilmember Gamble's question kind of brought up a question for me. So you mentioned there's all these other kind of subcontracts that you took over, cleaning and other. Are we going to continue with those contracts, or are those types of services that maybe could be done in-house or using Metro in order to save money?
I don't see any savings in any of that. But what I'm talking about is we have a food vendor, for example, that we're feeding our inmates. They had a food vendor doing theirs. And it's not just as simple as saying, hey, give it to me. I mean, all that equipment was owned by one. I mean, so the food vendor, which is primarily, feeding our inmates, we wanted to move in now 500 more inmates into an existing system. Well, imagine what they're telling us. We can't do that in 90 days. Healthcare system, a complete healthcare operation was out there. We have our own healthcare operation, so we needed to move it in. So there's savings in a sense, but I caution you to be, not you personally, but to be careful with this, because that's state inmates. It's one of the frustrations I've had with all the activism about this subject. The issue is those are state inmates paid for by the state. So the savings, you got to figure out who are you trying to save money for. My job is to work for Metro government. That's who I work for, the people of Davidson County, for the jails. And I wasn't sent here to save the state money in their prison system, privately or publicly. And so we've been working hard for efficiencies, but the local government is my priority. That's what I'm trying to do. And so I want to make sure our staff are taken care of and that the inmates that are there are taken care of, but I also want to make sure that your tax dollars you're giving me are returned by the state, or you guys need to figure out what you want to do. It's a complicated arrangement because it's really not Metro's responsibility.
I appreciate that clarification.
Yeah.
Councilman Nash?
As some of you know, I spent a couple of years in law enforcement. And kudos to the job you've done this year. And then really the mental health issue's been brought up a couple times tonight, and I think that's a great program. I can tell you as a law enforcement officer, you'd have somebody out on the street, they wouldn't necessarily qualify for an emergency committal at mental health, but they're still out here being disorderly, posing kind of a threat to the peace of the nation, and you would arrest them, and it was to keep them safe, and you knew when you took them to the sheriff's department, they were going to be safe for that night, and it's a shame that sometimes that's the only thing we could do and can do, and that lasts today. I mean, there's no magic wand out there where you can instantly find a home for somebody that's having those issues, making sure they take their meds and the like. And I hope we can find a different way to transition, because I agree with you. I'm not sure that it should be in the criminal justice system, but at the moment, and I don't think things have changed too much since I've left, that you are the only best alternative, and we appreciate the work you do.
Right. You know, I was going to say Commander Nash. I was getting in trouble, and but he brings up something I want you to know. This is a real life story. This is not something that made up. I was 5 or 6 years ago. I was at my house. It was a Saturday night. I get a phone call from a criminal defense attorney. Y'all all know him. And he says to me, hey, Darren, I need some help. Do you remember, and they named a family, do you remember our kids played on the Little League baseball team 3, 4, 5, 10 years ago? We had kids the same age. I said, no, I don't remember the family. And he said, well, I'm at their house. It's 10:30 at night. And he said, can you help me? He's bipolar, and he's thrown the stereo down the steps or something, and the family's nervous and concerned. And can you help me get him committed to Middle Tennessee Mental Health? And so, you know, this may not surprise you, it may surprise you. I said, no way. I mean, I have 10 people way in front of him to get to Middle Tennessee Mental Health. In our institutions, we have people who are butchering themselves, potentially, attempting all sorts of psychosis and episodes that are much more violent, much more risky than throwing a stereo down the steps. And so when he's asking me that, just practically, I said, never. It would never happen if anyone wanted him to go. I mean, it's not the sheriff or anybody else. And I said, that's just not going to happen. So he hangs up. It's 10:30 at night. He calls him back in about an hour, and he goes, hey, Darren, this is a criminal defense attorney. He says, if we have him arrested, he would be seen by mental health when he gets down there. Wouldn't he? And back to Councilmember Nash's point, I said, I can't answer that. I mean, as a father, it sounds crazy. I know the answer. But I knew what he was leaning on is any help he could get to the family who was standing there screaming for something. And I said, I can't answer that. I hung up. I think I said goodbye, but I hung up. He calls me back in an hour. He says, Darren, he's in booking. Can you make sure that the mental health people see him? So of course, they were going to see him. So a day or two goes by. I couldn't get it off my mind, so I called the mom. I didn't know her, but I had reason to connect because of the situation, and our kids must have played on some ball team 10, 15 years ago. So I called her and asked her to meet with me. She met with me for the next 4 years. The sad part is he was arrested to get mental health. Councilmember Nash just said that. The criminal defense attorney is a smart man. He was trying to help friend. I learned as I went through this experience that, and by the way, this is not important, but I want you to understand why I pointed out. This family could buy the hospital. I'm not exaggerating. It's not a resource issue. It's 2 a.m. Your son is off his medication. You're scared to death, not necessarily of him, for him. And so resources aren't the issue. It's services. Where do I go? If you could write the check and buy the building, you can't go. And so I lived through this with this mother and many times. And I remember one day we met and I said, how's he doing? And she said, he's doing much better. And you could see they were proud about that. And then she just broke down. And I said, I'm sorry, I didn't mean to do that. And she said, you know what? He can't work. He's doing better. He can't work because he has a probation officer, because he has a court date, and so the reality of what we do in our country, and it's not the police fault. Guess what? Guess who calls them? I mean, we had a lawyer calling this time, but it's usually us. I see a man if I walk out in the street. You and I would do this. If he was naked and singing songs of elephants flying over, I promise you're going to call the police. Well, you call 911 and you say, you can't be naked out here. Any other modern country says he needs help. And so what ends up happening is the police are called, they do their job. You can't leave a naked man in the park. And you can't leave a son who is uncontrollable in a house. But we're all searching the same thing. That son needed help. The people who are naked need help. And unfortunately, the police are used to solve it. And then they're criticized for how they do it. And then jails typically are horrible once you arrive there. I mean, you suffer from anxiety, which is very common. We put them in a room with 44 people, very few windows. So, I mean, that's just not the way to do it. And my belief is, at my little time, I want to at least get that individual where they belong. That young man who threw the stereo, the naked man, y'all were here. We had a man climb up on a sign out on the interstate 5 or 6 years ago, blocked traffic for hours. CNN was here. We negotiated the man off the sign, blocked traffic for hours. You know what we did? Put him in a car, blue lights, bingo, got him, locked him up, carried him to court, convict him, give him probation. There he goes. We can do one thing. And so that man on the sign, the man who was naked in the airport, the young man who threw the stereo down the hallway, and the homeless man who's going to be arrested in 30 minutes from now don't deserve to be criminalized. They are ill. You wouldn't do that for a person who was off any other medication. It's not anybody's fault, but it's time to move on and try to deal with it. And I hope we have a chance to do that. Sorry about that, Commander Nash. That's your fault. I know. I'm going to call you Commander because you got me started on that.
So we are at time. I am scanning the room for last-second questions. Seeing none, thank you so much, Sheriff Hall and Mr. Lutz, and who's my last person? I wrote it down. and Mr. Hudson. Appreciate you spending time and answering our questions.
Thank you, Madam Chair, and all of you guys.
Tomorrow, we start at the same time, 4 o'clock. We have Parks and Recreation, Library, Arts Commission, Public Works, and Metro Water.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.